It's 2:17 a.m. You are sitting on that hard emergency room chair. The blanket is too thin, the room is too loud, and your pain is climbing, sharp, rhythmic, wave after wave. The doctor finally walks in, glances at your chart, and asks, "Scale of 1 to 10?" You say 8. They pause, look at how calm you appear, and say, "You don't look like you are in that much pain." In that moment, your heart sinks, not just because of the pain, but because you realize you have to explain yourself again. You have to explain that sickle cell pain doesn't always look dramatic, that you've lived with this body your whole life, that you didn't come here for drugs. You came because you had no other choice. If you live with sickle cell disease, this moment is painfully familiar. I am Susie Muke, and welcome to Susie Muke Sickle Cell and Health Tips. Today, we aren't just talking about pain, we are talking about power. I'm going to give you the exact words, tools, and medical terminology to advocate for yourself in the ER so you can get the care you deserve. The ER saves lives, but it can be emotionally exhausting for us. It's not always that doctors don't care, it's that they are often generalists, not specialists. They are under pressure, and strict protocols often make them hesitant with pain medication. That means the burden of explanation falls on you, often while you are in crisis. Advocacy isn't about being aggressive, it's about being prepared. So, here are 4 things you can do to advocate for yourself. Number one, the cheat sheet. One of the strongest advocacy moves happens before you ever leave your house. Have a printed 1-page medical summary. Why printed? Because phones die and pain makes it hard to unlock screens or find files. Here is what needs to be on it: your full name and date of birth, your diagnosis, sickle cell disease, and what type if you know it, name and contact information of your hematologist, your usual pain crisis treatment plan, medications that work for you, medications that do not work or cause side effects, drug allergies, your baseline hemoglobin if you know it, past complications such as acute chest syndrome, stroke, or a vascular necrosis. When you hand this to the triage nurse or doctor, 2 things happen. First, you save valuable time, and second, you immediately establish credibility and clarity. It quietly communicates, "I know my condition and I have prepared for this moment." Second, speak their language. Doctors respond to specific medical terminology. Instead of saying, "My pain is really bad," use the clinical term. Say, "I believe I am experiencing a vaso-occlusive crisis." This triggers a specific medical protocol in their training that pain sometimes doesn't. Also, be specific about data, not just feelings. Instead of "nothing is helping," say, "At home, I tried hydration and heat for 4 hours. The pain has escalated from a 6 to an 8 despite oral medication." This helps them make faster decisions. Third, know your rights. Many patients don't know this, but the NHLBI guidelines suggest that for a sickle cell crisis, analgesic treatment should ideally begin within 30 to 60 minutes of arrival. If you have been waiting hours, you can calmly and respectfully say, "I know the NHLBI guidelines recommend treatment within an hour for a crisis. Is it possible to check where we are in that process?" You aren't being difficult, you are referencing national standards. 4. When you feel dismissed. Sometimes, even when you do everything right, you might feel unheard. If you feel you are being labeled as drug seeking or dismissed, do not get angry. Get administrative. Ask for the patient advocate or the ombudsman. Every hospital has one. You can say, "I feel my condition is not being fully understood and I'd like to speak with the patient advocate." This usually shifts the tone of the conversation immediately towards cooperation. I want to end with this. Living with sickle cell requires a strength most people will never understand. Advocating for yourself is not a sign of weakness, it is wisdom. You are not a burden, you are not too much. You are stewarding the life God has entrusted to you. The Bible reminds us that the righteous cry out and the Lord hears them. Your voice matters to God and to your doctors. If this helped you, please do these two things for me. In the comment section right now, write ER ready and share this with another sickle cell warrior or caregiver who needs this toolkit. Stay strong, stay anchored, and I'll see you in the next video.